So wanted to check in with you. I know nationally and in Rhode Island, we've seen the pace of vaccination slowing down a little bit. What do we take from that, especially when it comes to reaching people who haven't gotten the shot yet?
Yeah, I think what you're seeing nationally and to a lesser extent locally, though, is a lack of vaccine urgency. In other words, when you think about who got the vaccine at first, we rolled it out like a lot of other states did, high risk populations first. I think what you're seeing is some of the populations that are lower risk, they just have to fit this into their busy lives. And I respect that. You know, it's interesting. I have 3 kids who got their vaccines last Tuesday. You know, part of that was me having the flexibility during the day to bring my 2 sons to the Sakanasset site. My wife, Gail, had to drive up to Gordon College and get the daughter. It was a 400-mile round trip in one day to get her vaccine. But we really sensed vaccine urgency because in my family, we really respect vaccine urgency. And I think one of the things you're seeing across the country is people really trying to find a reason for vaccine urgency. And I think when you look at the younger population, what they should be really thinking about is, yes, I want to protect you, but I really want to protect your family, you know, your grandma, your grandpa, your parents, whatever. I just need to protect your family around you, those high-risk individuals around you. And a lot of people do have high-risk individuals around them. So that's just a reason for vaccine urgency in our younger population. But you know what? We're actually seeing very good uptake in Rhode Island in the younger crowd. When I look at the 16 to 39-year-olds, 41% of the 16 to 39-year-olds in Rhode Island have gotten 1 dose. Now, last week, there was only 31%. So I got pretty good uptake in a week here. So I'm pretty proud of the Rhode Island 16 to 39 group. They're heading in the right direction in that regard.
How will we know, how long will it be before we'll know if enough of them are saying, yeah, I'm going to go ahead and schedule it? You know, do we give them a couple weeks? How do we know? Like, what's the timeline?
Yeah, so what we're planning on doing over the next couple of weeks is we're doing our best to make our sites more accessible. Like at the Sakanasset site and the Duncan site, they're accepting same day and walk-ins. So we're trying to make it so if you want to stop by, we've got a vaccine for you. We're going to be trying to do that at more sites as well. You know, over the weekend, we piloted a pop-up site that worked pretty well. We're there doing testing and vaccination. And I think you're going to see more of that in Rhode Island. In other words, we're going to try our best to make the vaccine same day available for you, but also make it so we can bring the vaccine to you. So one of the things we're doing more so is trying to partner with other organizations, some factories, some manufacturing sites, and trying to make sure we bring the vaccine there because we can do that now. Now that the demand is, you know, it's a bit less, we can try some different strategies to make it more accessible to people, make it more available. I think that's the answer, though. I think it's about making the vaccine more available. You know, vaccine confidence is still pretty good in Rhode Island. And I think you still see a very good amount of vaccine confidence in spite of what happened with the Johnson & Johnson vaccine. I think people respect, well, there was a problem, it was identified, and now we understand, so people can make their choice. I think that makes sense. And I think when people see an honest system that's transparent and tells you what's going on, people have confidence in the system. And I think that's what we're seeing right now in our national vaccine system.
So I don't know if you had put that out there, if Department of Health had put that out there. You can actually walk into Sakanasset or Dunk right now without an appointment and get vaccinated.
Yeah, that's kind of new. We haven't really talked about it, but it's something we're doing today. And you know, even at Sakanasset and at Dunk, you can actually just walk into our sites today, and there's same day appointments for the days we're open. You know, that's Tuesday through Sunday, and that works pretty well.
Been this issue we've heard about the last few days, people not getting their second doses. How big a problem is this locally? And if somebody has missed their second dose, can they still go ahead and get it?
Yeah, so in Rhode Island, we see 95.5% of folks have gotten their second dose. So that's really good. I mean, I'm really proud of Rhode Island for doing that. That's okay. And for some people who just haven't gotten their second dose, maybe they're scheduled in a lot up, you can just go get the second dose. You have to wait like the 21 days for Pfizer, the 28 days for Moderna. But if you have to come later, just go get it. There's no reason not to do that. And I think the main thing there is you really need to get both doses. 1 dose gives you really good protection, but we really want to protect you from the variants of concern. You know, it was bad enough we had a pandemic, but the virus mutated. So I really need to give you the best immune protection I can give you. And I get that when I give you 2 doses. So I got 2 doses. My wife got 2 doses. My kids are excited about getting their second dose. And I know it might seem strange to say my kids are excited, but we're going on vacation in May. And so they get it. They want to be fully vaccinated. It's a really good feeling, by the way. I will say this. When people get fully vaccinated, I can't explain it, but a lot of people just tell me, I feel relieved, and they feel a little weight coming off the shoulder. And Lord knows we've all had a lot of pandemic stress. If there's just one thing I can do to help you be a little less stressed, I think it's a really good thing to do is get yourself fully vaccinated, relieve some of that pandemic pain you have.
You make a really good point. Beyond protecting yourself or protecting others, your life could be better and more fun actually once you're fully vaccinated, right?
Yeah, you really you feel better, and you can do more things. I mean, quite frankly, I think what a lot of people think about with 2020 was the year of can't, and in the year of didn't happen, and I think when you look at the summer of 21, it should be the summer of fun, and I think it's one of those things where you should be able to go to the beach more, get outside more, do things more. And I think when you saw what the CDC said today, where, if you're fully vaccinated, you don't need to wear a mask here, there, and we're looking at that guidance to really incorporate that to Rhode Island. But I think it really highlights the point is when you're fully vaccinated, you're just going to, one, feel better, and you're going to feel more comfortable doing more things. And when your friends are fully vaccinated, you're going to feel more fun getting together with people. And I think that gets to like part of what we need to do as a community is like, yeah, let's just all get our vaccine so we can get back to normal here.
I love that idea. I know you said your kids are vaccinated because they're older teens or earlier 20s. I'm taking it, but we have this 12 to 15 group, right? That could get emergency use authorization soon. What is the plan to reach those younger teens and get them vaccinated as soon as possible?
So it's the Pfizer vaccine that is really going to be going in front of the Food and Drug Administration for an emergency use authorization for 12 to 15-year-olds. I'm excited about it. Really, we know it's been a safe and effective vaccine for older. There's every reason to believe it's going to be a safe and effective vaccine for that 12 to 15-year-old. Expect to see us coming to your school. That's something we're talking about. Expect to see us with places where they're close to where the kids are. And, certainly children will be welcome at our state vaccination sites. And yes, parents can definitely come because we certainly don't expect 12, 13, and 14-year-olds running throughout our state vaccine sites without their parents nearby. We expect them to be there with them, and they're welcome to do that. And, really what I'd say is that we're planning on this having an emergency use authorization. And I don't know if it's going to be in the next month or two, but that's what we're kind of hoping for. We'd really like to see that 12 to 15-year-old group fully vaccinated before school starts up again. It's just going to make the school year of 2021 much more enjoyable for everybody.
Would pediatricians get involved at all? Or you're a pediatrician yourself. Would they maybe do that because maybe you're going to go for a checkup before school anyway? So maybe that way it's one less appointment.
Yes, we're definitely going to be more into doctors' offices by that point too. In other words, our usual medical system, we have a lot of great pediatricians in the state, and they're really expert at giving vaccines. They know how to do it and have a smile on their face at the same time. So that's definitely something we plan on partnering with is in enlisting our pediatrician community. I think one thing for the 16 and older crowd, I would challenge everyone who's 16 and older to get fully vaccinated by time graduation rolls around and before prom rolls around. I mean, I think one of the things to think about is as a 16, 17, 18-year-old, try to support everybody who's just in your class, get a little school spirit around this. But like, I definitely think before there's proms and before there's graduation, there's every reason to believe every 16, 17, 8-year-old should be fully vaccinated. It just ensures we're going to have a more normal season. And I think if there's one thing you can do for seniors this year is give them a decent senior year. And that's one way to do that.
So you might go out to schools, would that be potentially during this school year, or maybe like come to school during the summer just to get a shot as like a location? How would that work?
Yeah, so we have to work with the municipalities, and we're talking about partnerships. So, we have to go where we're invited. We certainly aren't barging in any schools, but it's like one of the things we're talking about is with the cities and towns is where do you think we can be the most helpful, and how can we make the cities and towns most helpful as well? Because really the schools, work with the cities and towns. And so as a state, we just want to be encouraging and supportive and see how we can be the best help. One of the things Rhode Island's been doing really good at is we've been getting vaccine. I think you're seeing other states across the country are declining vaccine orders. We're not declining vaccine orders, just so people know we're getting as much as we can get because we have high confidence Rhode Islanders want to get the vaccine and they want to get fully protected so we can have this robust summer that we've been waiting for.
I think people would love that. So you got the potential of doctors' offices, the ability to walk in. Any other plans to do, outside the box places? I've heard of like even bars, restaurants, social events where people have the opportunity to get vaccinated.
Yeah, so I think when we're talking more about it for us is more, there might be more pop-up sites. In other words, a tent might show up in a community that's maybe when one where it's a little harder to get the vaccine to. That's what we've seen. We've done that last weekend. I think you might see more of that coming out in Rhode Island. I don't plan on seeing us coming to a bar near you. I know that happened in New Orleans where there was a
Yes,
shot for a
yeah,
shot. And
yeah.
so that's New Orleans, that's not Rhode Island. Okay. So I'm not saying it's a bad idea. But I wouldn't plan on that coming to you anytime soon. I think look for us more likely at a school or at a tent somewhere or one of our state vaccine sites or at where you work. We might be showing up there too. One can never tell.
Workplaces, maybe like a workplace that has
Yeah,
many workers.
like Electric Boat, we've got a partnership with them. I mean, I think when you have a large employer, there's strategies that we can do to try to get as many people vaccinated as possible. And one of the things I think it gets back to is when you look at vaccine urgency, if you're someone who's lower risk, are you really going to take a day off from work to get the vaccine? And the answer is probably not. And a lot of people just quite frankly can't leave work to get the vaccine. So it really thinks it's incumbent upon us to find strategies where we can help people figure out how to do this. This is part of why we're available weekends. And this is why we have some clinics that go at different hours. So, this is the stuff we're looking at. What we're looking at is how can we be more creative and how to be more accessible and more available, because I think confidence is high and we really want to have sites where every question can be asked and answered. At all of our state sites, there's a healthcare provider there who's happy to answer whatever question you would have. Particularly with the Johnson vaccine issue, people should have questions about this. They should want to know if it's right for them. And, when you go to pick your vaccine, we should have someone there who can answer that question for you so you can feel a peace of mind, because we want people to feel peace of mind so they can have high vaccine confidence.
I like that phrase, vaccine confidence. I was reading today, maybe we want to avoid calling folks who have not yet been vaccinated vaccine hesitant, because maybe they're not hesitant. Maybe, as you say, it's just their work schedule, childcare schedule, and they will get vaccinated. We just need to make it easy for them.
Absolutely. And I think it really gets to one, we want to inspire vaccine confidence. We also want to inspire vaccine urgency. And, if you think about this just for other ways, like if there's something new to you, maybe it's just anything that you haven't had any experience with, you're new to you, like maybe you want to go buy a new car. I don't know anyone who just rushes into buying a new car. That's a pretty big decision, And like for me, if I'm going to buy a car, I take a year or two to figure out which one I want because I'm committing a lot of money. I need to have automobile confidence before I buy a car. By the way, we want to inspire vaccine confidence in you. We have a lot of people here ready to help you do it.
Cool. All right. Did I leave anything out, that folks need to know? It sounds like, you change as you go, right? You change the effort as you go each day, each week.
Well, I think when you look at our response, it's an adaptive response, right? In other words, we've been at this 14 months. I'm not getting tired, by the way. I'm fully rested and doing great. And I think it really gets to the point of like, we keep adapting our response to really accommodate where we're heading. Right now, the state's heading in a really good direction. Things are heading, we're seeing our deaths come down, our hospitalizations come down, our cases are coming down, our positivity rate's heading in the right direction. And with the variant out there, this is no small accomplishment. So people are doing a lot of strong, good work to make this happen. So we're just very thankful for all the work everybody's doing.